specialist, and I also a member of the MSA New Jersey board. I've been a member here for about 4 years, so it's always a wonderful opportunity to join these yearly conferences where we get to share what we know about MSA and share ways in which we can better cope and manage a diagnosis. And therefore, I will be talking today on MSA and the roadmap after you get a diagnosis. It's a lot to talk about and a lot to take on. However, I'm hoping that this can provide at least some guidelines for you after you receive a diagnosis of MSA, something that you can make reference of when you begin to think about your journey. So today we are hoping to focus on a few points and learning objectives. And I want to talk about what emotions are there after we are diagnosed and how we cope with those emotions. We want to talk about how we develop a healthcare network and networks of support. We also want to talk a little bit about navigating benefits and access to care, which is also, a very important part of this process. And we want to begin to touch on advanced care planning. I know that after this presentation, there will be more in-depth conversations on advanced care planning and thinking about later stages of MSA and considerations for those later stages. So I will touch upon advanced care planning lightly, not to be redundant. So why talk about emotions after the diagnosis? I think not only is because I'm a behavioral health provider that obviously that it's an important area for me, but it is also the basis of the beginning. It is certainly a sense of shock when we get a diagnosis. And if we don't develop a sense of clarity as to how are we going to handle these emotions and how we're going to move forward, it can make things a little bit more difficult and challenging for us. So the first thing I want to say about that there is no right or wrong way to feel after we receive a diagnosis such as MSA. There are different array of feelings that can come up. Some are negative, some are neutral, some may be positive. And all of those are valid, right? We all are very different and unique on the way that we face challenging situations. So feel free to give yourself the room to feel what you need to feel at that moment. I also want you to be able to remember, if you're the person being diagnosed, that be cognizant that this diagnosis really is not only for you, but also for your loved ones, for your family, for your close friends, and people in your community, especially for your family. It's a diagnosis as well for them. So it's good to have that in mind so that we can validate and support each other in those feelings. The other point that is important is that once we acknowledge the feeling and validate the feeling, that if we recognize it as being negative, it's something that's not helpful, that we do something to not sit on that feeling or that negative emotion for too long, just because it can just foster more negative emotions and more difficulties as we try to adapt to having MSA and to the changes that MSA will bring to our lives. So let's not sit on those emotions and let's try to transform them into energy healing for planning and for the journey that you're about to embark. One of the things that people tend to do a lot when after a diagnosis like this is to isolate. People don't want to be seen. People might not want to talk about it. And isolation can definitely lead to feelings of depression. They can lead to anxiety just because we're sitting on those thoughts on our own. And that creates a lot of anxiety, the rumination about the potential things that may happen. And it definitely it can be a paralyzing feeling that is going to delay the action that we need to take to begin to adjust. When we identify anger, for example, it is normal. This is also a process of loss, what we call an anticipatory loss or anticipatory grief. And anger is a very strong emotion that can pretty much foster a lot more stress and tension in our bodies. That is certainly not going to be helpful for your physical well-being either. There is also another emotion listed here, relief. Some of us are going to be relieved just to know that there is a name to what we'll be looking for potentially for a long time, because as we know, the diagnosis of MSA can be challenging. We can be diagnosed with many other things until we finally determine what it is. So there might be some relief. And that's more of a positive emotion, which is also normal. It's so that we can breathe easier by having a name under everything behind everything that we have been facing until now. So how can we then manage those emotions? How can we then take care of our emotional health when we're having so many feelings about it? And one of the first things that is important for us to do is to share those feelings with those close family members and close friends, to begin to have an open communication and an honest communication about what we're going through, what is this like for us. And it's not easy. I understand, especially if we are private kind of person, it's not easy to all of a sudden begin to have open communications about feelings. So I understand that this may take some time, but it's something to keep in mind. We had a talk last week from the MSA Trust from the UK titled, How Do I Tell the Children? And they focus on having those open and honest communications with children, young children, adolescents, adult children as well. And the takeaway point of that presentation was as well to have that open and honest communication, even with children, obviously at their level, with words that they understand, and when prompted by their inquiries and questioning as they begin to see changes. So it's very important, and that can also prevent us from getting to that point of isolation. Writing down your thoughts and feelings about your diagnosis in a journal is certainly something that can be helpful for those of you that maybe you like to write already. Wonderful. You may already know that writing is a wonderful outlet. And when you begin to write thoughts and feelings in this journal about the things that are going in your mind, or the things that you're going through right now, it can certainly help you gain some insight, have a better understanding of where these thoughts and where these feelings are coming from. And it can give you clarity as well for your planning, clarity in your thinking as you begin to plan for future care needs, or to problem solve for situations that are maybe presenting right now. So it is not for everybody, but if you want to try it, you might decide that you like it, and it can be a really, really good outlet. The other thing that I wanted to talk about is, and I mentioned before, there is going to be potentially a sense of loss, that anticipatory grief. Well, give yourself time to live with that grief, to stay with that grief. Give yourself the time and the respect that feeling needs. It is a feeling. Grief doesn't have a deadline of how long it will last. Grief is something that can come and go. like any other emotion. So I think it's important to acknowledge that grief. There is a sense of loss of many things in our lives, starting with our health. And starting with, our functional ability, of course, our situation at work, if we're currently working out there in the workforce, so that it's a loss of sense of independence. However, it is important to keep in mind that is rather a need for adjustment that we kind of want to focus on. That sense of loss is certainly not final, but what we need to focus on that would be helpful at that moment is that need to adjust, right? I'm losing maybe a functional ability for a certain task. So how can I gain some level of independence by doing it in a different way, right? So that's a way to hopefully be able to cope with that grief and that loss. Always helpful to not grieve alone, or to have these negative emotions in your mind for your own. It's good to seek help from a counselor or a clergy member. The reason being that when we talk with families and friends, we're going to want to protect them from our own feelings and our own emotions. As I mentioned to you, your family is also going through a difficult time with the diagnosis. They're going to have their own emotions, and we're going to be protective so that talking to family and friends is wonderful, but to be able to really subjectively talk to someone about how we really feel and our fears and concerns, it is handy to have someone that can be objective and can stay objective and help us process and manage those emotions that come as a result of the diagnosis. Good to stay engaged. That's a good way to manage your emotional needs. Continue to participate in activities as long as you're able to. That goes into that adjustment theme again. It's a great way as well to cope with that grief. You're losing something, but maybe you're gaining something else in the process. So do activities as much as you can for as long as you can. Stay active so that you can stay positive. Joining support groups is a great way to connect with people, and the MSA coalition in your local chapters have a lot of support groups for the person with MSA, family members and friends, support systems in general, where you can meet a lot of people going through similar situations, where you can gain a lot of knowledge from one another, get lots of information and resources. So please do visit your local MSC chapter or the coalition to find support groups in your area. And obviously, surround yourself with a good support system. Develop your own network of support, right? So reaching out, we're talking about the opposite of isolation. We want to reach out. We want to find out who's around us, who can help us out. Who can we count on? How can we develop that support network? And in doing that, one of the important things to keep in mind is, you have a couple of areas in this network of support. You can develop a disciplinary healthcare team that can best help you and your family manage the primary care needs, the specialty needs, the adjustment needs, and the emotional needs after the diagnosis throughout the disease progression. So this group of people, this network of support, can also change throughout the journey after diagnosis. But identify who those people are. You are not alone. And the most important thing to remember is that you are the most important person in this network of support. So how can you then connect to all those people. And I listed here and I made this graph so really just to focus the attention on the importance of you being the center of this network, where you can be able to express your needs, your wishes, so that you can be the person that can sort of in collaboration with all of these people in your life, dictate quality of life measures, and focus on living with wellness, even in the light of a diagnosis such as MSA. So some of the people here are all healthcare providers, but I also added family and friends and community resources as part of that network of support. Not all of these people have to be in your network. Some of these people you will meet, some of them you will not. But it's good to know who they are. And I'm probably missing others, obviously, that may be part of your care as well. But this is just to give you a general idea. But you are the center of all this. So how can we then become that partner in care? How can we be that leader, that we need to be when we're managing our physical and mental well-being? Get familiar with the role of the members. Find out what each member of your team does, what knowledge and skill they have, and how they can be helpful to you. Find out how to access their services. That's very important, through checking with your insurance companies if they are in network, right? So that you can find a wonderful, let's say, movement disorders specialist, but let's figure out, can I access this particular person? If not, what are my options? Usually health insurance companies will be able to let you know who's in network and who's not. Checking in with their office after you do that to make sure they're taking new patients. Inquire as well about their availability for telemedicine appointments. Now telemedicine is big, and pretty much everybody is doing telemedicine right now because of the pandemic, and those telemedicine services are being covered by insurance companies. Acquire their contact information. Make sure that you know how to get in touch with your provider and develop a plan on how to access them if in need, when they are not in business hours, or if they're not going to be in town. What plan would there be in place in case you need them? It's important to educate yourself about the disease and the management of the disease. Remember that the trajectory of MSA is and looks very different for everyone. However, be informed and ask questions. Bring your designated member of the team to your appointments with your doctors, in your therapy appointments, to your support groups. And that designated person can be really anyone. It could be a member of your family. It could be a friend, anyone that you feel comfortable with, that you can begin to identify as that key person, your right hand kind of, that can begin to share all this knowledge and engagement with you. Caring for, as you begin to do that, it's very important to also remember that this person that will be your right hand or your care partner also is going to have needs. And it's important for that care partner to also develop their own system of support, kind of like the one you have, but maybe their own. And they can determine what those needs are that they will have as they work in supporting you in your care. So it's very important to care for the care partner for a successful collaboration with this multidisciplinary team. So make sure that when you do have that partner in place, it could be your spouse, it could be a child, that you have communications about the expectations, the level of comfort in doing this as well, so that you're choosing the right person to be in partnership with you. Establish communication with your team. Make sure that if there are any changes that you're being made aware, that there are updates, that your team is communicating with each other, and make sure that that communication is going through the same channels, right? So that that person of support that you have identified would be able to answer your questions, that that person will be able to triage the other team members that can best respond, have a response or an answer to any questions that you may have, so that there is a channel that has been determined where things go through, so that you make sure that you're not missing any pieces in that communication. So it is important to do this and to not do it alone. So begin to think who's that person for you and have a very open communication with them. Sometimes it's good to have more than one person in sight, just so that if that care partner needs to go away for a few days, if that care partner needs some respite and need to take a break from the situation, that you have someone that can be able to fill in and take that position for a little bit if needed. So your professional healthcare team, this is a list of some of a few and the most commonly utilized providers in the treatment of MSA. There are going to be probably more, obviously depending on your needs, but the primary person who's going to be prescribing your medications and is going to be pretty much heading this professional healthcare team will be the movement disorders specialist, and maybe the clinical nurse, who is probably going to take an active role in helping you with your care as well. And a movement disorders specialist is a neurologist with additional training in the management of movement disorders. Therefore, this person is your neurologist specialist. If you don't have a movement disorders specialist, you can ask your general neurologist or your primary care doctor for a referral. And every person with MSA hopefully should have a primary care provider. Really, every person, every one of us should have a primary care provider. And a primary care provider can be a doctor. Sometimes you have physician assistants who function as a primary care provider, or a nurse practitioner can also fulfill this role. They can all prescribe as well medications as needed. And usually they work in collaboration with each other. A physician, a doctor, a physician assistant, or a nurse practitioner. Usually they function within a group setting and they can collaborate within each other, among each other. Excuse me. So make sure to ask about if you have a primary care physician and you need to find someone, make sure that you ask them about if they're familiar with MSA and discuss whether they will be open to receiving literature and information on MSA. In your role as the person with MSA, you also become your best advocate. So don't be afraid to take that role of educator, an advocate for yourself and other people who have been diagnosed. And MSA, it's after the diagnosis with MSA, this part of educator is probably going to be part of your journey. The other people important in your team are your rehabilitation specialists. They will be along the way with you, providing services that will focus on prevention, education, and meeting the adjustment needs through your journey in order to maintain your quality of life, which is determined by your own values, your goals in living well with MSA. So your physical therapist, your speech and language pathologist, your nutritionist as well, I put in there. These are all people that you probably will see regularly throughout the course of after the diagnosis, throughout the course of this journey. The changes will the needs will change, and the physical therapists, the speech pathologists, the nutritionists will be able to guide you as to forms of adaptations where you can be then able to function in different manners, but still be able to function and adapt and participate in life. So it's very important to establish who those people will be. And you can get those referrals as well from your neurologist or movement disorders specialist. They usually have a team of rehabilitation specialists that work with them. So get familiar with them and definitely work closely with them. Get a referral, as I said, from the neurologist, because you probably will need it as well for insurance reasons, so that all those services will be covered under your insurance company. I also mentioned the pharmacist. Obviously, the pharmacist is going to be that person that will keep an eye on your medications and will make sure that your meds will be ready when you need them. They are like the police for medications, so that if there is anything that counteracts that maybe has been newly prescribed that is going to potentially counteract with another medication, then we'll alert you about that. Those are people that you can quickly ask questions about, you know, if you want to start taking a vitamin or something like that could maybe be contraindicated with medications that you're currently taking, your pharmacist can advise you if they're comfortable and if it's within their scope of practice, whether it's okay or not. So the pharmacist can definitely be an important part of your team. And then I also mentioned the psychiatrist or a neuropsychologist. We talk about the emotional needs that just come from a diagnosis. And there might be changes in our psychological or emotional needs that may come from changes in your brain, changes at the organic level. Sometimes if any psychosis or any hallucinations, delusions come across, which is not common, but it may happen later on or at some point throughout the disease, the psychiatrist can help look into those things and prescribe medications if appropriate, but those cases are rare. The neuropsychologist or the psychologist can function as well as a psychotherapist and can provide guidance, support, and help you manage those emotional needs. And last but not least, I put there the clinical social worker role and the role of the social worker, which is very vast. A social worker within a medical setting is we can title a medical social worker. You can have a master's in social work or a clinical social worker in this role. You can find a social worker in many places. Some insurance companies have social workers that work in the areas of care management or case management. And these are the people within the health insurance company that will help you find providers in your network. These are the people that can help you answer questions regarding coverage or limitations in coverage, get you through authorizations for certain procedures or medications as well. And in this care management or case management role, sometimes you also find nurses, and they're sometimes called nurse navigators that can interchangeably play the same role of the social worker when it comes to providing those type of supports or informational community resources and connection to community resources. The social worker can also be found in home care agencies. The social workers are with clinical licenses, can provide psychotherapy services, counseling, and they can help you manage and help your family manage those emotions and adjustment needs that are definitely going to be evident throughout your journey. So look for a social worker. We can be very helpful in different areas. And if we don't know something, then we can certainly help you find the answer. So I guess that's why I love what I do. So your support network is just not your healthcare providers. Your support network is more than that. This support system may include your family members, your friends, your neighbors, an exercise teacher, trainer for the patient or the care partner. So remember, it's also looking for that support network, also for your care partner, right? So remember, you're a team. You and your care partner is your right hand. You also want to look out for the well-being of that very important person in your life. So you can have people that may volunteer and run some errands for you, members of the church, a clergy member, a paid caregiver through a home care organization can also be part of that. Respite care services. I want to say that it's never too early to begin to look into home care, to begin to look into respite care. You at least want to begin to get familiar with those services so that at the time that you may need them, you may already have identified an agency that you may trust already. You begin to make relationships with a provider that you feel comfortable with, of home care provider that you feel comfortable with. This could be agencies that a social worker can provide to you in your area or your insurance company, or they could be privately paid, depending on what the service is that you're looking for. Your growing network may also consist of various groups, such as music, dance, or exercise classes, support groups, service of advocacy organizations, and religious affiliation. All that is talking to the life participatory approach to managing MSA, so that you can find ways to continue to work towards maintaining your quality of life by inclusion, participation. There is a dance group called Dance for PD, or Dance for Parkinson's Disease, which was founded by a dance company in New York City and a support group in Brooklyn, New York, that joined together and began to bring dance classes to the participants there. And now they develop Dance for PD. This Dance for Parkinson's is now found in, I believe, it's 25 countries. It's really big. And there are dance professionals, professional dancers who are now trained specifically on Dance for Parkinson's strategies, so that through movement, inclusion in social activity, and mental stimulation, you can maintain that level of functioning longer, hopefully, through these type of activities. So if you never knew about it and you're curious, you can always Google it. Dance for Parkinson's, and it's not only for Parkinson's, it's really dance for anyone who has a movement disorder and just needs to be active and at the physical and emotional and social levels. So check it out if you can. As a care partner, don't be afraid to ask for help. I want to stress also, I've been doing that through this presentation. Many people want to help, but they may not know how. I think some of you may know and may have experienced that sometimes people want to help, but their help might be not as helpful as they're hoping to be. I remember my aunt once going through a difficult time, and what we do is we were, people tend to just bring food to the home, and this person kept bringing her food, and it was some things that she didn't enjoy, that she couldn't eat, that she didn't like, and she was just hoping that this person that was so gracious, that wanted to help so much, she just wanted her to stop bringing her food because she didn't know what to do with so much food, and she was getting overwhelmed. So we definitely want to have an open communication about that too, and be able to express to those people that want to help in which way that will be more effective for us. So just make sure that you're able to approach the subject with those people, and that you can have sort of like a list of the things that that will be helpful to you. At the same manner, when you have someone reaching out to you and ask you, how can I help? How can I help? And you're not sure at that time, make sure to keep their names in a list, or to keep their names in mind, so that when you do need something, that this person or family member or someone in your circle, in your social circle, is looking to be able to be helpful. And they will feel very happy if you reach out and you tell them, can you do this for me? So it's not a crazy idea. It works. So please do keep those names handy, because if they cannot help you now, maybe later on they can be of support to you. So a lot of people in that network of support or your care team, and for various reasons, for various roles, this MSA is a condition that requires a multidisciplinary team of people that can help you at all levels, and it's a good thing to be able to reach out and get the support that you need. And I knew that I just needed to take a breath for a moment, because I've been probably talking for a while, and I invite you to just take a look at this beautiful picture of balance and serenity, and just breathe. I hope you took that breath with me, so that we can move on. I know I've been talking a lot, and I know that these slides are heavy with words. So I just needed to allow you to rest your eyes for a moment. So we're going to move forward with the second part of this presentation, when we're talking about more concrete things, such as when to apply for benefits, how to access services, and things of that sort. So when to apply for Social Security, how do we know when the time is right? And most likely, remaining in the workforce for as long as possible may reflect a personal desire, a desire for financial independence, of course. However, if your symptoms are worsening, you may really have to begin to consider that disability. When it comes to applying for disability and the concerns in terms of the financial changes, of course, there's gonna be adaptation needs and adjustment needs in that area as well. But also remember that disability may afford you a consistent income, maybe not as much as you were getting, when you were fully employed, but you will have a source of income that will be consistent, and you will have Medicare coverage. Providing for your healthcare needs can be possible through other venues besides your employer's insurance. So that while you apply for Social Security and you get benefits through the financial benefits or the Medicare benefits, you can look to other areas such as COBRA through your former employer. You can look into benefits through your spouse insurance if that's applicable. You know, if your spouse is working and they have the possibility of obtaining health insurance through them, that's definitely a way. And there are other income-based sponsor plans such as Medicaid that, or the market fair, which is a way to get coverage, health insurance coverage at prices that we can afford, and that's the market fair. So there are other areas that you can tap into and look into while you wait for disability benefits to be approved. And to start your disability application, the most important thing really is to start with that starter kit. I have a link at the bottom of this slide that will take you there. And that link is going to tell you exactly what are the things that you need to start this process. So, for example, prior to beginning the application, it's extremely important that you collect the medical evidence that document your illness and your symptoms. The neurologist or the movement disorders specialist that is experienced with Parkinson's and its variants such as MSA or other kinds of movement disorders such as MSA can definitely be helpful in wording things and documenting things in ways that will be useful for the Social Security determination. Brain scans are usually helpful as they often show characteristics in the affected areas of the brain. Other medical documentation should include the records of your diagnosis, lab tests, treatment history, responses to treatment, hospital visits, and even personal statements from your physicians can be helpful. When you sit down to complete this application, having everything at hand will be helpful so that things don't get delayed. So hopefully you have everything you need at once. And they would also be looking at your work credits, meaning how many years have you been working and paying taxes, so that their financial eligibility would also be determined that way. So your work history certainly will be something that you want to be familiar with. And again, the link below at the end of this screen will certainly give you all the information you need to start that process. One good news is that we don't have to wait so long to get those Social Security benefits approved due to compassionate allowance. The compassionate allowance is a program that allows the Social Security Administration to process certain diseases and diagnoses based on the extensive medical proof that they are extremely disabling. And MSA was approved and listed as a compassionate allowance condition since 2011. So for more information on how to submit a compassionate allowance condition, go to their website that is also listed here in this slide, or you can call the 1-800 number there. Usually it's simple. It's in part of the application to Social Security. One question would be, is this a compassionate allowance, or is this a condition that qualifies for compassionate allowance? And so that it will be stated right there in the application. But you can certainly visit this website and learn everything you need about it. So the good thing about this benefit is that once approved, you don't have to wait the typical 2 years that any other medical condition will be required to wait in order to get Medicare. Your Medicare will be effective almost as soon as your benefits start for Social Security. So it is fortunate. Now let's talk about other important considerations. And this is the last part of our presentation, which is advanced directives. And why do we want to think about advanced directives when we're talking about what happens after diagnosis and, earliest stages. Well, because this is usually a subject that is avoided, and we usually wait until last minute to do this type of things. And the reality is that we all, whether you're MSA diagnosed or not, all of us should have an advanced directive in place. Working in hospital settings, I have seen many unfortunate situations that could have been prevented if there was an advanced directive in place. Having an advanced directive in place can prevent a lot of family feuds and family conflict in reference to what our loved one would wish or would have want. So the advanced directive is a legal document that you can complete on your own that can help ensure that your preferences for various medical treatments are followed if you become unable to make your own healthcare decisions. Your advanced directive in health, right? So these are advanced directives for health, goes into effect if your physician has evaluated you and determined that you're unable to understand your diagnosis, treatment options, or other possible benefits and harms of the treatment options. So that this advanced directive does not become active when you do it or once you establish it in writing. A lot of concerns that people have as well. What if I change my mind and then I said I didn't want to be resuscitated and now I want to be resuscitated? And what if I'm not terminal and then I can actually leave, and then they say that I can be resuscitated, and then because my advanced directive says I don't want to, they don't save my life. And all these questions and concerns come up, but be assured that the advanced directive really will only be active and take effect if a physician or if you're thinking about capacity, 2 physicians have determined that you don't have capacity to make decisions on healthcare for yourself. So at that point, they will go to your advanced directive if you have something that is very clearly written and stated as per your wishes in health, or they can go to your healthcare proxy, which is the person that you have appointed as your voice in decisions of healthcare in the event that you cannot express those wishes anymore. And that these types of advanced directives, this is what I'm talking about right now, durable power of attorney for healthcare proxy, is that person that I was talking about that will make those decisions for you. Why is it important to have this? It's important to have it because in the event that you are incapacitated, the healthcare proxy will be your next of kin. If you are married, you're legally married, your next of kin will be your spouse. If you're not legally married, but you have children, your adult child will be your next of kin, so that any decisions regarding your healthcare will be asked of that adult child. There have been cases in which the spouse or the adult child have been absent or estranged for a long time, and then we have physicians trying to get in touch with them for decisions in healthcare, and that's when the family conflict begins, right? So if you are legally married and for some reason you believe that your spouse is not the best person to speak on your behalf, if in the event you are incapacitated, then you certainly need to have something in writing where you are appointing a new person to be your voice in decisions of healthcare. As well, make sure that if you are choosing someone that is not obvious, maybe not your spouse or whoever you're choosing, actually, I'm gonna take that away. Make sure that the person you're choosing is aware that they are your healthcare proxy and that you're counting on them for this type of to act on your behalf if this ever happens, so that they understand what your wishes are, so you can have those conversations and that they feel comfortable to direct your healthcare team based on your wishes. And the living will or instruction directive, I'm sorry, is that document then that clearly identifies what you want and you don't want in life-sustaining treatment in the event that you're unable to make your own healthcare decisions. So that's a very detailed document as per the things that you want or don't want to prolong your life, if you're unable to decide those things then. In order to access these forms, you can visit your state, your government page in your state. I have at the bottom of this slide, the state of New Jersey, advanced directives and forms. You can go to that link and get those from there. You can also get them from your primary care provider's office or your neurologist office. They're usually available in those settings as well. And there are other things such as polls and that are also options to discuss with your primary care provider or neurologist. But I'm sure that that's information that you will be given during our next presentation later today. So this concludes my presentation for today. I also added here several resources. All this information, the information provided in these slides, I gathered from all of these resources as well. So they're wonderful because they supported the information I'm giving you. If you had a chance, if you were to have a chance to request the Cure PSP Care Partner Guidebook and their Cure PSP Guidebook, I will definitely recommend it. They are very comprehensive. The Davis Finney Foundation for Parkinson's, a lot of things are very relevant for MSA. So I will certainly, all these are guidebooks that are free and accessible to you. So if you can have them, please order them and have them handy. They are an excellent roadmap, actually. You can go to them anytime. They have a lot of resources. And of course, websites, visit our Multiple System Atrophy Coalition, our New Jersey chapters for more specific information for services in your area. The American Bar Association, if you need an attorney to go through the power of attorneys and durable power of attorneys forms and documents. If you need to go through an attorney, please, you can use one of these resources for that. The Family Caregiver Alliance is a wonderful resource for care partners. And the National Academy for Elderly Law, of course, is another good way to find a good elder care attorney. Elder care attorneys are excellent in identifying the eligibility specifically related to financial needs or resources of people, eligibility for services such as Medicaid, and other state-funded programs. So that concludes my presentation. I always like to conclude my presentation with a quote, and I used this quote before, but I always find it very appropriate. Acceptance does not mean resignation. It means understanding that something is what it is, and there is got to be a way through it. And this was said by Michael J. Fox. So yes, there is always a way. So surround yourself to a great group of people, a network of care, a team of care for you and your care partner. And together, you will always find a way. to go through it. So I wish you the best, and I will be here available so that I can answer any of your questions. Thank you very much for the opportunity again.
Okay, this is the question portion of the conference. If you have any questions, please list it in the Q&A function on the right side of your screen. And wait for questions to come in. In the meantime, Miss Victoria Pina Cardinelli, how do people with MSA go about telling their support systems?
Thank you, Julia. So, and it's Victoria. Thank you. So the don't worry, yes, Victor. So I think that is a very important question. It's one of the first questions that come up after you receive a diagnosis. And I think the key points is to have an honest and open communication with your family members, with your close family members, and your friends. I think that, and your close friends, I think that one of the main reasons I wanted to start the presentation with emotions that come up is so that we can raise awareness and just kind of check in as to how are we feeling about this diagnosis before we're able even to have those honest and open communications. And if we're not sure, if we're confused, if we're having a whole bunch of feelings, the ones that I, were listed in the presentation, a combination of all of them, that's okay. And that's normal. And it's okay to communicate that to your family and friends. This is a very shocking time for me, and I'm trying to figure out what's happening, how I'm going to move forward. So I think that honesty and open communication can then help also your family and friends to begin to talk to you and figure things out as to how to begin this journey together.
Okay, we have a couple more questions coming in. This is from Barney. Will it be possible to get a listing of the resources listed in the presentation?
I understand the presentation will be available in our website, and I know Kim is listening here, and they can probably let us know at the end of the Q&A where to find these links and these resources.
Several of those resources are listed on MSANJ's website, but also this presentation along with Victoria's slideshow will be posted on our website within the next couple of days. So you can find it there as well.
Thank you, Kim.
And how do we connect with a social worker? Do they need a neuro to provide a referral?
So social workers can be found in different settings. I think you just need to ask wherever you go, so that if you're being treated by a movement disorders specialist in a neuroscience center or within a group of physicians, you can always ask if there is a social worker within their practice. A lot of social workers are now being embedded into specialty practices just because the need has been identified for a social worker to help coordinate services and begin to guide that journey with a care plan. So please just ask, even if it's your primary care physician, sometimes primary care offices have social workers embedded there. You can also find a social worker through your health insurance company. Those social workers in health insurance companies have also been known as nurse navigators or care planners. So it doesn't have to be a social worker title, but it could be a nurse who is working, assisting with that care planning piece. So just ask for one in whichever of the medical settings you're getting care from. Oh, and one thing that I want to say, I'm sorry, Jude, about that is social workers embedded into those programs. You usually, most times, you don't have to pay for those services. Those are listed as part of support services, and they don't really require you to get insurance authorizations or insurance issues when working with a social worker, unless you're seeing one for psychotherapy or behavioral health services.
Okay, I guess this kind of went with what you just answered, but somebody asked if insurance covers this expense for social workers and the nurses, etc.
Right. So there's support services if you're looking for care management or case management services within that are embedded within the providers in your healthcare network. If it's behavioral health and you're looking for psychotherapy and counseling, those services do need to go through insurance, and most insurance will definitely cover behavioral health services. The best way is to call your insurance company and find out, and I think that's one key thing to do as well as you begin the journey, is to call your insurance company and understand your benefits. Some insurance companies as well have services for chronic disease management, or so intense chronic management disease, and then you can be assigned a person, that care manager that I was talking about, that can be that point contact within the health insurance company, so that when you're calling your insurance company to find out about benefits and resources and coverage, that you don't have to tell the story 1,000 times, which is one of the things that is most frustrating as we navigate services, to have to retell the story to many different people. So if you're able to identify a care manager or case manager or navigator, whatever name they give it, through your insurance company, make sure that you can obtain that name and kind of begin that relationship, so that you can go back and forth with them regarding your benefits and your eligibility.
Okay, again, this kind of goes with what you were saying, but who's the best person to oversee the overall care? Is there the care manager, and then how do they go about finding care manager?
Yes. So when you're developing your network of support, we kind of talk about two sides of network of support: your healthcare team, and then we talk about your family and friends that will be there walking through this journey with you. So in your healthcare team, usually maybe if in the movement disorders clinic, there is a clinical nurse working with your movement disorders, that could be a person that can help you with that management of that team, meaning making sure that that team, the healthcare team, is connecting with each other. So it could be your nurse at the movement disorders clinic. It could be your the person in the insurance company, if that service is provided. I want to make clear that not all insurance companies have this service, so you need to ask. And as well as there are also private pay care management services that are social workers that can help with that, but that will be a private pay expense if you're looking to hire someone independently to help you manage the care team and help you make medical appointments and things like that. So there is an association for case management, the Case Management Association, where you can locate a case manager in your community. Those services are private pay. Now, when it comes to family, you do need to identify someone in your family. It could be your spouse or a child, an adult child, a close friend, that can come to appointments with you, that can be aware of all that's happening, so that that person can be the person coordinating your care among all of your healthcare providers. So that your care partner, yourself, and your person in the healthcare team can have that ongoing communication and make sure that everybody else in the circle is talking to each other, right? So it's that care coordination.
So what would you recommend in terms of preparation for emergencies, in terms of documents, information that should be ready to be on hand?
Yes, very good. So at the end of the presentation, one of the things that we talked about was advanced care directives. And the reason why we want to talk about those at the beginning is because we all need to have one. Especially we need to have those when we're able and capable and clear of thinking, so that we are not working through all this when we are already going through other situations where adjustments are needed. So early on, begin to think about, do we need an attorney to help bring up these documents and develop these documents for durable power of attorney for finance, or durable power of attorney for healthcare? If you don't have a lot of assets and you don't have a lot of things, and your life is mostly simple, you might not need to hire an attorney, and you can do these documents yourself. I provided a link on the slides where you can find these documents. You can go to your local or state government website and obtain the documents from there. And you can do those yourself. Sometimes you may need a notary that will notarize those documents for you, and that will be it. But if you have a lot of assets, if you have things that you need to make sure that you need to put in order, if you need to have a financial document, then if it gets a little bit more complicated, you might want to hire an attorney for that. The other thing is definitely develop a file where you're keeping important information, the list of all of your healthcare providers. I also mentioned developing a list of people that have been offering to help, right? So if they're offering to help and you don't know yet in what capacity they can help, well, have a list of those people, because the time may come when you need to reach out to them. So have a list of all those telephone numbers at hand. Find out how you can reach your medical team after hours. What is their protocol for that? What for them is an emergency? In what cases you need to go to the emergency room? So those are plans, specific plans that you definitely will need to develop in coordination with your care team.
May I just add to this?
Mm-hmm.
Another really good thing to have, particularly if you are still traveling, is a binder with all of your medical details in it. I know we had a scare with our mother on a trip, and now this is going back several years before there was more known about MSA, but still even today, it's not common, and depending upon where you're traveling, it could be very difficult. So I think it's important that you have some sort of binder that explains what MSA is, a list of all the medications you're on, a list of your contact facilities, a list of any of the current MSA symptoms you are currently dealing with. So for example, if you have NOH, the low blood pressure issue, that you explain what it is, because the low blood pressure, the neuroorthostatic hypotension that you have in multiple system atrophy is very different from cardiac related low blood pressure. So there needs to be that distinction. And that was one of the issues we had. We had to take our mother to an emergency room in California. They didn't understand the difference. And treatment was, it was challenging. It was challenging, to say the least. They were treating her for something totally different, and we were trying to explain what it was. And they didn't necessarily want to listen to us. Again, MSA in 2005 was really not on anybody's radar. So I think it's also important that you have some compilation of your medical history to take with you if you are traveling or doing anything outside your regional area where your doctors are.
Absolutely. And I would add to that, maybe a good idea to kind of make a copy of that, so that it is safe if you're carrying it with you. If you're on a trip, maybe a copy of that should stay home somewhere else, so that you also may have another place where these documents can be found in the event you need such additional support in handling any type of emergency.
Exactly. So excellent. And guys, please don't be shy. Feel free to jump in. There's the Q&A box. Ask any question you want. We'll be here for a bit longer with Julia and Victoria. So please, like I said, don't be shy. Ask your questions.
We have another question coming in. What do you do if the person that is listed as person in advanced care directive to make decisions is not available when something happens? And is there a way to list more than one person? And if someone can't be reached, what happens then?
Yes, there is a way where there is certainly a way where you can list more than one person. Actually, I think you can list, at least in the documentation, up to 3 people. That could be primary, secondary, tertiary. Hopefully one of those 3 people can be found, right? At any type of any emergency. If you have a living will, a written, detailed living will in terms of your health wishes, that is also a document that all of your physician and all of your physicians, all of your healthcare providers should have a copy of that, so that if you need to go into the hospital, that document can be accessed, and then your treatment can be then dictated based on that advance directive that has been written by you and signed by you. Also know that the advance directives, you can make changes to them, right? So that if you have an advance directive now and this is what you want today, but then as you learn more about the condition, you're changing your mind about those wishes, know that you can go back and change your advance directive. And you can continue to do that as long as you have the mental capacity to do that. That this is why it's also important to have conversations with family members. That person that you have appointed as your healthcare proxy, have conversations as to be very clear as to what your wishes are. In case of a hospitalization, if this is the situation, that this is what I want. And make sure that you can talk about your healthcare proxy being comfortable, in making sure that your wishes are followed, because your healthcare proxy might not be in agreement with you, right? So I think it needs to, those conversations need to happen so that you can develop that trust, and your healthcare proxy can feel comfortable in letting the people, in that emergency room or that hospitalization, let them know what is it that you want, and be your advocate.
Thank you. And what else do you know when a patient's resistant to facing these issues, they're in denial or having trouble accepting? How would you go about this process?
That's a good question. I think it is normal, and denial is definitely a defense mechanism. I think acceptance is a process that comes and goes, meaning you might wake up accepting today, and tomorrow you might be in disbelief. So I think that there is a lot of fear and ambivalence in the beginning stages, and this is normal. I think that we need to be patient, and we need to provide our loved one with a lot of support, a lot of validation, a lot of compassion, reassurance that everything will be okay no matter what. And so that the moment that person is ready, whether it is to make that follow-up appointment, wherever it is to just talk to someone about it so that they can continue that process of adjustment to these, to the finding out that, you have MSA, that then, you can be there to support them in that next step. So for some people, it might take a little longer. Some people might be ready to jump into it and just is what helps their anxiety to just start moving on and just develop my team and get, learn everything I need to learn from it. Some people may need more time, and that's okay. So I think not rushing, validating, supporting, reassuring until they will finally come, to hopefully to that realization and begin to take some steps.
Great. Again, feel free to ask any questions. She's very well knowledged in this area and can answer some of the questions that you might have. In the meantime, I'll ask a question myself. So what is something that's often overlooked, such as a resource that can be utilized?
I think often we overlook as well the need for the caregiver or that care partner. And I think because we focus so much in the diagnosis and the person that has been diagnosed, obviously that is often overlooked. What does my care partner also need for support? So I think it's important to remember as well as a care partner, what is it that, so that you can do that parallel planning. As I find out that I need to do this for my loved one, what is it that I'm gonna need in order to be able to do this and do it well, right? What is my capacity? Knowing myself in terms of my psychological, emotional self, knowing my physical health, how much of all this is realistic that I can do on my own, and when do I need to know that I'm gonna need help and support. So beginning to build your own network of support, so that as a care partner, so that you can take some respite care, meaning a break from the care partner responsibilities that you're having, so that you can attend your own medical appointments, so that you can attend your exercise class, so that you can meet a couple of friends for coffee once in a while, right? Which is also the things that we want the person with MSA doing as well, having a live participatory approach to this journey, so that you're doing things that you love to do for as long as you can do them. And when you cannot do them the same way that you used to do them, that you are working with your rehabilitation specialist so that you can begin to modify the way that you do those things, but that yet you can still do them. So developing that system of support for the caregiver, I find is often overlooked. And then also I mentioned in your healthcare network, I don't remember, but the home care agencies, home care resources, they can be a resource of support. And I think it's good to start finding out who those home care agencies, organizations are that are available to you in your area, so that you can also figure out what is the cost. Is it covered by insurance companies? Is it not? So that you can also begin to do some financial planning along those lines as well. So I think even if you don't need those services right now, beginning to plan for those from the beginning, or at least to begin to look into those services, is important.
And how can people find MSA specialists in the area? And they also asked where they could find safety strips and bed devices for going to the toilet.
So MSA New Jersey and the coalition, their website could be a good resource for that. Also, if you have a rehabilitation specialist that you're working with, those rehabilitation specialists have, I will say all the times, resources for this type of need. So I will reach out to them. You can also, when you're looking for a movement disorders specialist or a neurologist specialist, movement disorders specialist, you can also call your health insurance company, and they will be able to give you a list of those specialty providers in your area. So I think that will be the most specific and ways in which you can begin to find those.
We have about 5 minutes left of this conference session. So any last minute questions, now's the time. We'll see. So what are some, are there options for treatment? Like, is there ones that you can pick and choose from, or is there just one set that's what it is?
Treatment, MSA treatment?
Yeah.
For in general, okay, for my understanding, again, I'm not a physician. However, I think that is a conversation to be had with your movement disorders specialist or your neurologist. I do know everybody's disease is unique, even though it's the same diagnosis, but the presentations will be different. So that even though we have a general idea, a knowledge as to what are some of the things that we can foresee happening, how soon and the severity and what will present and what will not is very individualized. So definitely the plan of care will be individualized for you, even though you have the same diagnosis as somebody else with MSA, same diagnosis, but plan of care certainly may look different based on your specific needs and circumstances.
And finally, what are some reasonable things we can ask of our friends and families to do for help?
I think, as I mentioned before, I think it's important for you to ask yourself, what is it that I need? What is it that will be helpful to me right now? And then be able to write those things down. I invite you to have a journal, a book, where you can process these things, where you can write down things as they come up, because those needs may change from time to time. So if you ask yourself, what is it that will be helpful to me right now, and you kind of begin to make a list of those things, I think you'll find your answer that way. And let brainstorm with your care partner, with your family. You can even ask your family member, if you're the person with MSA, what do you think we'll need right now? And have these conversations, and reach out to the families and friends that said, hey, what can we do to help?
Someone also asked if they're eligible for Social Security disability if they're retired, or if their income's above average.
I would say you definitely apply, submit an application, because you can definitely be eligible for some benefits. So definitely apply. I gave you at the slide, the Social Security link where you can go in and start an application, or call the Social Security office to discuss your specific situations, so you can get more specific answers, But start your application. There is a starter kit that also will tell you everything that you need even before you start the application process. Everything is done online right now, especially because of the pandemic. So you can start the application and know that you have several days to complete it. So you don't have to sit down and complete it in one sitting. You can always save it and return to it and gradually complete it until it's fully done. So don't feel that you have to rush. It's good to have everything you need ahead of time if you can, but you can always pause it, get what you need, and come back.
Okay, I think this about wraps up the end of this first session. Thank you everyone for attending. We're going to be having a 15-minute break, and then after that, we'll start the second session with Donald Pendley and Gian Chirico, who are hospice directors and CEO/president.
Thank you very much.
Thank you, Julia. Excellent. You took the words right out of my mouth. Excellent job moderating, Julia. Excellent presentation, as always, Victoria.
Thank you so much.
You're very knowledgeable, so we thank you for your time and participation. And attendees, thank you. And like Julia said, we'll be back in 15. Hope to see you soon.
Thank you, Julia. Thank you, Kim. Bye-bye.
Bye.
Thank you, everybody. Bye-bye.